In regard to more equality in policing, we've already talked. We took a whole program, press conference, and talked about that. We have laid out to the General Assembly a comprehensive plan that will work, that will make things better, bring about more justice, and I'm asking them today to pass it. It's there. It's good. We've worked with some of the members of the General Assembly on this. It needs to pass. I'm also challenging our Department of Health and in Ohio Environmental Protection Agency to do more to address the lead paint problem in Ohio. I've talked a lot about this in the past. I won't spend time today, but it's wrong. It's wrong. We have to change this. It's crazy that in the year 2020 we still have children who are being poisoned by lead paint. Infant mortality, huge disparity in infant mortality between African-American babies and white babies. Huge disparity in the mortality of the mother. And that both of those simply have to change. We're doing work, but we need to do more, and that is our commitment. One of our commitments today also is the creation of the Governor's Equity Advisory Board. The idea behind this is to have a permanent group working with us, people brought in from the outside, people not necessarily in government, but people who bring a wide array of experiences who can advise our cabinet members and who can advise me in things that we need to do to make this a more just society. This is a permanent, ongoing group to help guide us as we address the underlying conditions and root causes contributing to disparities in life and health in Ohio. With me today is Alisha Nelson. Alisha is the director of Recovery Ohio. She was in the Attorney General's office with me, where she headed up our what we call our heroin unit. So her work has been, a great deal of work has been in regard to recovery, a great deal of work in regard to fighting the opioid epidemic. She's been working directly with the Minority Health Strike Force, and she's here today to talk about our new Equity Advisory Board. So, Alisha, thank you. Thank you very much for being with us.
Thank you, Governor. It has been my pleasure to serve the residents of Ohio through my work on the Minority Health Strike Force. The Strike Force members have brought great energy and passion to this work, and we're grateful to their contributions and service. Governor, we often hear you talk about action and how important it is to create real and meaningful change for the people in our state. And so I'd like to spend a little time this afternoon sharing one piece of how this work will be implemented. The next step in recommendation 1, or commitment number 1, in the executive response is to create the Governor's Equity Impact Board. The board will work to improve state efforts to dismantle racism and promote health equity. The board's members will draw on the expertise that currently exists within Ohio's communities of color: African American and Hispanic Americans, Asian Americans who speak a multitude of languages and live within our state, will represent diverse viewpoints from sectors like education, healthcare, public and private business, community organizations, and members of the criminal justice community. It will be important for the board to provide continuity to the work we do. It'll also be important for this group to advise the state on how we move forward and utilize all that can be made available to communities across the state to promote wellness in all of our residents and all of us. Finally, and most importantly, the members of this group will hold us accountable to our commitments to address equity. Thank you for the opportunity to share this important work, and I know it'll have a lasting and positive impact on communities of color. So thank you, Governor.
Director, thank you very much. We appreciate your good work. I know you've worked very, very hard on this. Let me also introduce someone who has also worked very hard on this, a member of my cabinet. Ursel, there you are. Ursel, you're there. Ursel McElroy. She's our Director of Aging. She's got, as Alisha does, she has a big job. She's also with me in the Attorney General's office. She headed up our Elder Justice Initiative then. She's been working directly with the Minority Strike Force. She's with us today to really kind of represent our cabinet and to talk about some of the specific commitments that our directors have made. So, Ursel?
Thank you,
Good to have you here, and I'll let you take off and talk a little bit about what you and the members of the cabinet are doing.
Okay, so thank you, Governor, and thank you for the opportunity to be a part of this really critical work. I'm so appreciative to work with such a wonderful cabinet. Every day I'm in awe of their hard work and the transformative ways and ideas that they bring to the table. It doesn't matter if it's midnight, if it's early morning, each of them will certainly answer the call. And they don't only answer the call, they listen and then they act. And I think about some of the work that they've done, looking at our healthcare system, working to make it more accessible, making it more meaningful. If you consider telehealth, the steps that have been taken quickly to enable Ohioans to stay safe and to still receive critical needs met with minimal reduction during COVID. With EPA, our water system and lead abatement efforts, realizing those things need attention, they weren't afraid to take action. Our highways, we knew our infrastructure needed attention and things were overdue. And so we took on that work. And again, I get excited when I think about mental health and the attention we're bringing to those issues. Attention that's necessary for people that have been left in the shadows far too long because of stigma. And Director Hall, working on a benefits bridge to address a problem that has existed for so long. People have been pennies away from having their livelihood cut because of rules. With Director Hall and the governor, we know that we can do better. And then General Harris, helping in such an incredible way now during COVID, surging into food banks, helping with our nursing facilities, and helping with the civil unrest we've had throughout our state. I could say so many things about members of our cabinet, and I just want people to know that how privileged I feel in working with them. But what's important is I want you to understand and appreciate what this cabinet is willing to do and lean in to do. And so with that, I want to first extend grateful appreciation to members of the Minority Health Strike Force for the report. And regarding the report and our cabinet's response, we know that Ohio's public health entities have long advocated for the basic needs of Ohioans. They have spoken about the impacts of social determinants of health. Social determinants are those things that can contribute to our future health and opportunities. Social determinants are our basic rights, and they extend far beyond our basic needs, and they are complicated. And we know that Ohio's public officials must join together to address the historic decisions that were made. Decisions that continue to have an upstream impact on disadvantaged Ohioans that can begin at birth and years later can result in adverse health outcomes. So, in terms of the report and the initial thoughts of the cabinet and what our agencies can individually pursue, as the governor mentioned, we first came together and we looked at this with a critical eye and with the eye of opportunity. What we understood was that there were areas that we could impact within our respective departments. Our commitments revolve around our people, the state's workforce to drive change. Our commitments revolve around our policy and programs to advance equity in our work and our public service, to achieve more equitable, accessible, and culturally competent public services. And there is work already occurring and work to be done. In addition to the 10 commitments within the response, are actions identified by the cabinet that can make a difference, that are so important to the changes that need to happen. For example, the Ohio Department of Transportation will be focusing on ways to incentivize the ability for transit authorities to provide on-demand transit for healthcare-related trips. And on the internet front, which we all know provides us with opportunities and access, the Ohio Department of Transportation is also working with Innovate Ohio to explore options to expand broadband to underserved areas, with particular focus on rural schools and homes, by placing fiber optic cables in interstate right-of-ways, For public health, the Ohio Department of Health has a state health improvement plan, which we often refer to as the SHIP. And the SHIP provides state and local health departments and hospitals with a menu of strategies to improve the performance on public health priorities. For example, to affect adverse childhood experiences and kindergarten readiness, both which have long-term impacts on health outcomes. The SHIP features strategies in early childhood home visiting and early childhood education. And certainly, I would be remiss not to mention within my agency, the Ohio Department of Aging. We've been working with experts across Ohio to develop a strategic action plan on aging, a plan that we refer to as the SAPA, and it includes strategies that will be implemented around community conditions, including economic stability, housing, transportation, and elder abuse and neglect and exploitation. It focuses on health behaviors, including physical activity and nutrition and access to care, including long-term home and community-based supports and workforce capacity. We know that in all the work that we do, a coordinated approach has to be taken across all sectors to improve and achieve health equity. And so the SHIP and the SAPA, for example, working together, include a cross-sector effort to improve house quality and affordability, including reducing housing cost burden for those most at need. And then I also want to mention one other good example, because there are so many, to demonstrate our commitment. Within the Ohio Department of Rehabilitation and Correction, they have utilized what's known as the Healthcare Effectiveness Data and Information Set, or the HEDIS measures. And they use these to help internally evaluate the quality of diabetic care for incarcerated Ohioans. The HEDIS data set are one of healthcare's most widely used performance improvement tools. This is an example of the type of objective measure that can be used to evaluate performance. So these are just a few of many efforts that are underway or planned. And as the response explains, there will also be a strategic plan and a board. These elements are critical to moving the needle on the systemic issues and complex issues of disparity. Our planning will reveal the most impactful and those factors that we can influence. We know that it will require a major shift, a shift buy-in between all levels of government and among all Ohio communities. But we are up for the challenge. We are up to moving the needle on this critical issue. And I want to say thank you, Governor, for allowing me to represent the Cabinet here today, to be able to express the energy, the passion, and the will of the Cabinet to move this forward.
Director McElroy, thank you very, very much. I appreciate you and appreciate Director Nelson. Appreciate what you both have done. I know you worked very hard on this, but you know, as we've talked about, our work is just beginning. We have more work to do. The goals that you all put together, I know you both directly involved in writing this, is a beginning. But no one should think that it's the end-all and be-all. We have more things to do. The group that you're putting together to work directly with you, I think will give you some good, continue to give you good feedback and good guidance, and we'll keep focusing. So thank you. Thank you both very, very, very much. You know, there are racial disparities in this country. There are racial disparities in Ohio. We talked about them. Certainly in health, education, housing, and we could go on and on. There are many causes for this. Certainly racism is one of the causes. Sometimes it's systemic racism, sometimes it's very overt, sometimes it's more subtle. But sadly, in 2020, racism does still exist in this country. We have an obligation to look at these racial disparities and say, that's not right. We have to do everything within our power to deal with this. And it's incumbent, I think, upon all of us to do that. And we've talked today about some of the ways that we're trying to do that. But there'll be more things, and this is really is a work in progress. There are racial disparities in so many different areas, in health and education. Racism is a public health crisis, and this is something that we have to work on every day. It really goes back to what I said when I was sworn in as governor. And that simply is, our dream should be that every child in Ohio, wherever they live, whatever their background, whatever their race, they should have the chance to live the American dream. And we need to do everything we can to help them have that chance. That's really what our job is. Our job is to help create that opportunity, put them on a level playing field, making sure they get the education that they need, making sure the barriers that are out there that are caused by racism or other barriers are knocked down so that every child has that opportunity.